Everybody's angry, they feel like it's a slap in the face, they're confused.
I've been there for 16 years. My employment contract was that I had free parking. Now they've just changed that.
It's just really upsetting, you know, we give our best to the community and the government has just slapped us in the face and want us to pay more and more and more.
$1,200 per year to pay to park here.
This is a ridiculous decision. The very fact that this paid parking is putting profits into a private company and not a single cent is going back to the healthcare department is absurd.
Staff have just been stressed out. They're like, what are we going to do? This is so much. I didn't get a parking permit. Where am I going to park? What happens if we can't find a car park and we can't go to our shift? Nurses are worried they'll be threatened with dereliction of duty and, you know, not be paid for a shift simply because they can't park their car.
The transparency of the implementation of the parking is very, very poor.
So they haven't quite worked out yet what they're going to do with part-timers, casuals, but even our full-time staff. About half the nursing staff on our unit have not been accepted. They've been declined parking.
I applied just like everyone else did and, you know, I've worked here for 2 years. And I still didn't get it. So I'm on the waiting list and I'm being faced with $20 a day, $200 a fortnight. You know, I'm 21, I'm trying to save for a house and live my life as well as build my career, give my skills and care back to the community.
What we know is, of course, that this is a problem right throughout New South Wales.
We work hard every day. We dedicate everything we do to our patients while we're at work. And to pay to have to come to work to do that, it's something that we don't deserve.
Most of our nursing staff work shift work. They've been declined parking, so they've got to park in the wilds of Campbelltown and then walk to work at sort of 9:30 at night.
Walking to the train station, it's all uphill, 1.7 kilometres. Try doing that after a 10, 12-hour shift.
The Premier herself stood up in front of a camera and praised each and every one of you, the workers in our health system, frontline workers. In return for that, she tried to cut your pay and then, at the same time, make you pay to go to work.
We just ask that we're treated fairly. You know, other government entities like police officers, teachers don't pay to park. Why nurses? It's disgraceful.
The Nurses and Midwives Association has put a claim as part of our award negotiations for accessible and free car parking right across New South Wales. Campbelltown, you lead the way. Keep the fight up.